Good morning, everyone. My name is Eric Eversole. I am the president of Hiring Our Heroes, and thank you for joining us on our, I think, sixth or seventh installment now of Wellness Wednesday. We have a great discussion today from some real experts in the field when it comes to veteran wellness and importantly, what the VA and other organizations are doing to help prevent suicide in this country. But Wellness Wednesday is something that Hiring Our Heroes started as part of this move to our digital space about 9 weeks ago. We know that there's a clear and undeniable link between wellness and employment and the interrelation between those two things, protective factors or factors can make a significant difference in a service member or a military spouse's lives. So to us, to Hire Our Heroes, talking about these issues are of critical importance, making sure that from a mental wellness and well-being perspective that we're addressing the whole you is an important part of what we do. And so our experts today are really going to get into those issues deeply. So we're really honored to have them. Let me quickly thank our sponsors, the Wounded Warrior Project. These Wellness Wednesdays discussions are powered by the Wounded Warrior Project. They are a terrific organization to work with, an organization that is making a meaningful difference when it comes to the lives of our service members and their family members. So really honored to partner with them as part of this effort and part of a broader effort with respect to employment and wellness. So let me go from there and quickly introduce our speakers and then turn it over to Dr. Matt Miller. So very honored to have Dr. Matt Miller, who's the Executive Director of the Office of Suicide Prevention Program at the VHA Office of Mental Health and Suicide Prevention. He's going to talk about the importance of employment as a protective factor today. We're also joined by Dr. Eric Elbogen, who's a research investigator at the National Center on Homelessness Among Veterans, and then Renetta Bradford, who is the Veteran Employment Manager at the VA for Vets. So Dr. Miller, let me turn it over to you. Thank you for joining us and really looking forward to today's discussion.
Awesome. Very good. Well, good morning, everyone. Let's go ahead and kick things off with slide 2, please. And that'll show that this is great timing for the invitation and opportunity today. May is Mental Health Awareness Month. Fits really nicely with the Wellness Wednesday theme. I like that. The VHA theme for Mental Health Awareness Month is Now is the Time. Now is the time to prioritize mental health. Now is the time to access wellness, prevention, and intervention resources regarding mental health. And now is the time to watch out for others around us. The landing page that we're using for the Now is the Time theme and materials is at maketheconnection.net. On maketheconnection.net, you'll see a one-stop online resource for veterans, anyone, to explore mental health topics. There's 800 plus unscripted stories of veterans who faced challenges and took steps to improve their lives. There's filters for visitors to personalize content and easily find similar stories. So, for example, I'm a OEF OIF vet. I could hop in there. I could filter by OEF OIF male, and I could maybe see some stories or some accounts that I could relate to. There's also a resource locator there to easily find national and local support. So if as a OEF, OIF vet of the United States Air Force, if I hopped on, I used the filters, I saw a veteran, maybe it was an Air Force captain, sharing an experience, and I related to it. I said, you know, I would like to plug into the VA. What can I do? Where can I go? I could go to the resource locator to easily find the nearest location to me, contact information, and get things started in that way. Beyond the month of May and Mental Health Awareness Month, I represent the suicide prevention program as a whole within the Office of Mental Health and Suicide Prevention for the VA. The VA Suicide Prevention Office addresses three important things: prevention, intervention, and postvention services and programs for the 19 million veterans nationally. We do that through our community-based interventions. And for the 9 million VHA enrolled veterans across our 140 healthcare systems. And we do that through our clinically based interventions. Secretary Wilkie, I'm sure you know, has declared that suicide prevention is the VA's top clinical priority. And a deeper dive into the data tells us why. So let's go to slide 4 and take a look and walk through some of the data. Thank you. National suicide rates have risen for the last 20 years. Across the nation, the number of suicide deaths has been rising since the turn of the millennium. From 2005 to 2017, there was a 43.6% increase in the number of suicide deaths in the general U.S. population. There was a 6.1% increase in the number of suicide deaths in the veteran population across that same time period. Suicides now become the 10th leading cause of death in our nation and is one of only a few of the leading causes of death that's not declining, but is increasing. We know, for example, that as this slide demonstrates, in 2017, there were 45,390 total deaths by suicide in the U.S., but the number rose according to the just recently released CDC data from 2018 to 48,000 plus. Data specific to veterans highlight some particular concerns that I want to share and walk through with you. Next slide. Although the actual count of veteran suicide deaths seems much lower than the national count, the veteran suicide rate is 1.5 times higher than the national rate. The rate of suicide specifically was 2.2 times higher for female veterans compared with non-veteran adult women. The rate of suicide was 1.3 times higher for male veterans compared with non-veteran adult males. Male veterans ages 18 to 34 experienced the highest rate of suicides. Male veterans ages 55 and older experienced the highest count of suicide. So what does this data tell us? This data demonstrates many things, but in summary and to highlight, it demonstrates that the suicide risk and suicide preventative factors are unique to age, sex, and era of service, but also cut across age, sex, and era of service with our veterans. Notably, however, across all veterans, 69% of veteran suicide deaths resulted secondary to a firearm. There are signs of hope within the data, however, and I want to share those with you in the next slide. Let's take a look. Some important anchors of hope that we see within the data. Number one, we know from the data across 2005 to 2017, there's been a declining rate of suicide among veterans in recent VHA care with a diagnosis of depression. The change in the decrease in the rate of death by suicide of veterans diagnosed with depression and in VHA care has decreased at a level that equates to about 80 lives saved from 2016 to 2017, thanks to this decrease. Second, suicide rate among veterans in recent VHA care is rising slower than non-VHA veterans. Third, there's not an increase in suicide rate among women veterans in the VHA population. So although the rate of suicide in veteran females has risen from 1.8 times higher to 2.2 times higher, it has not risen with female veterans who are in VHA care. Finally, we're working very hard across the VCL, the Veterans Crisis Line, and across suicide prevention, the Office of Mental Health and Suicide Prevention, and in partnerships with offices such as the Homeless Office that Eric represents, to advance key strategies to address suicide and suicide prevention, intervention, and postvention. Some of those key strategies include universal screening. Universal screening is a fancy way of saying that at really important checkpoints in our healthcare system, we are asking about suicide. We are opening the door of conversation for veterans to share. Since we started universal screening, we have screened 4.6 million plus veterans for suicide. And out of the 4.6 million plus screened, 100,000 plus have taken the opportunity to talk about safety planning, to talk about suicide prevention, and to engage intervention strategies that they may be interested in and willing to pursue. That could be 4.6 million lives saved. That could be 120,000 plus lives saved just within the last year. We've also addressed and offer the Veterans Crisis Line. Veterans Crisis Line answers about 2,000 calls per day, about 1,800 per day on average. But if you add chat and text into it, it's over 2,000 per day. We recently made the move to telework so that we could protect and preserve our staff, as well as, and in turn, protect and preserve the mission of the Veterans Crisis Line. The last thing we wanted was to experience a mission risk that would jeopardize our ability to answer that call on a daily basis, hour by hour and minute by minute. We've advanced in terms of telehealth availability. Some of you have heard what we're doing with telehealth and telemental health, and the huge leap that we've made across March and April with regard to converting from face-to-face appointments to telehealth appointments. Before COVID, about 15% of our encounters in mental health were non-face-to-face, so telephone or video. During COVID until the present, shifted about 80% of our appointments are within mental health, are telephone and video connect. And we're receiving feedback from veterans that they like it, they appreciate it, that they value it, and that they find it beneficial to not even have to leave their home office or their home to meet with their mental health provider. The VA has also partnered with the DoD to produce the clinical practice guidelines for suicide prevention, noting from research interventions and strategies that which has been found to be effective towards suicide prevention. An important finding within the most recently released clinical practice guidelines is that something called lethal means safety works. Let's go to the next slide. Lethal means safety is a technical term for reducing access to suicide methods. Many people think that if someone is quote unquote determined to die by suicide, then it can't be prevented. But that's not actually true, according to the research. Suicide can be prevented, and reducing access to lethal means can be an important way to prevent suicide. An example may include bridges. Some people may say, well, if we invest all this money in erecting barriers so that individuals cannot jump from a particular high place, such as a bridge, what's the use? If they're determined, they're just going to find another bridge. What we find from the research in that example specifically and more broadly is that just does not tend to hold true. And conversely, lethal means safety, introducing time, space, distance between a person and a lethal means is life-saving. Reducing access to lethal suicide methods is one of the few interventions that's been shown to decrease suicide rates. About 90% of people who survive a suicide attempt don't go on to die by suicide. So what that really demonstrates then is that if you can stop it, if you can prevent it, they don't go on. And if they survive, they don't go on, which really then also speaks to the importance of lethal means safety applied to firearms, because the lethality of firearms is so high. Main point, if we can collaborate with veterans ahead of time to help them survive a suicidal crisis, we will have likely prevented suicide for the rest of their lives. And that's an important point to drive home. In this spirit, a key message that we promote is suicide is everyone's business. Everyone has a role to play. You don't have to be a mental health professional. You don't have to be a doctor. You don't have to be an expert on suicide. To support this message and to equip people with the information, we recently created Together We Can. It's a suicide prevention informational series to help veterans, families, caregivers learn more about risk and protective factors. Case in point, you're going to hear today from Eric Elgin regarding the relationship between finances, employment, and risk and protective factors for veterans. So until we get to Eric, here's where you come in. Next slide. We offer the following as points of suggestion, points of consideration under the heading of everyone has a role to play. Some important aspects here that I'd like to highlight. Number 2 on your slide in front of you, encourage open dialogue about stress and mental health. How much does the environment embrace wellness and talking about wellness and talking about mental health as an important aspect of wellness and an aspect that we all must address as a part of our overall wellness? Directing individuals to the Veterans Crisis Line 24/7. You know, a lot of people say, what if I open the door and if I get into a conversation, then I get in deep and I don't know what to do, and I feel like I'm in over my head. Always, always, always know we got your back at the Veterans Crisis Line. You can pick up the phone yourself, give us a call, 1-800-273-8255, press 1, or text us at 838-255. And with the person sitting with you, we'll dive in, we'll engage a discussion, we'll walk things through with you. Or if you just want to talk and get feedback from us, and then engage the dialogue with another person face to face, that's fine too. We're there for you, and we can help you in those situations. Key takeaway messages, I think, from my time today, which again has been an honor, includes the following. Suicide is a national problem that impacts veterans. There are anchors of hope within the data. Suicide is preventable, and we all have a role to play. Understanding risk and protective factors can inform the role that we play. Under the heading of risk and protective factors, topics relevant to this group, you'll see that risk and protective factors strongly align with variables such as finances, such as employment, such as debt, in particular credit card debt. So I think Eric's going to help us take a little deeper look into that and some of his fine work, which, by the way, we reference frequently within suicide prevention and have built into our strategic plan. So we're thankful for work he and colleagues in the VA do. So with that, I will wrap and transition. Hand it over for transition. Thank you.
Great, thank you. It's an honor to be here. I have worked at VA and worked looking at helping veterans transition to have a successful transition for the last 15 years. And I have run money management groups for veterans since 2007. So a lot of what I'm going to talk about are lessons that I've learned from people who were service members who were just leaving the military and they were being seen at the VA, and to try to help figure out what some of their protective factors were and what some of the problems were when they were coming out. And as Dr. Miller said, one of the protective factors was helping veterans have jobs, but it wasn't enough to have an income. And what began to realize is that a lot of service members, when they were on military bases, they had their basic needs met. They didn't have to do, they were doing their first budget, many of them for the first time, and this you might relate to, if you are active duty and you are just separating from the military in your 30s. Some veterans were doing paying their first rent when they were in 30s. That's much later in life than their civilian counterparts. The bad news is that predatory lenders know this. And studies have shown that the largest concentration of payday lenders are in businesses those businesses are in zip codes near military bases. And so as a result of that, they've shown that service members are 3 times more likely than civilians to take out payday loans, and that has repercussions for the rest of veterans' lives. Credit scores are down, they are in debt, and it has long-term implications. On top of all that, a number of veterans have to retrain to transfer skills, and I think that this Hiring Our Heroes is incredible in terms of trying to help veterans get their employment set up and have a successful transition. At the same time, what you do with that money is so critical. And one problem is that national studies have shown that military service members are more likely to have not only incur credit card debt, but to have 4 or more credit cards compared to civilians. So there is this combination of factors that I began to see, and the research began to show, and honestly, the stories I was talking, it was really the veteran stories that convinced me that this is something that needs to be looked at. While getting a job is important, it doesn't guarantee success. It's what you do with the money from the job. And what you could see, we did a national survey of post 9/11 veterans and found that 1/3, and this was a representative survey, this was not a VA survey, this was of all veterans who served since 9/11, 1/3 mismanaged their money. They were victim to money scam. There are a ton of money scams going on right now in this pandemic. Bouncing a check, going over one's credit limit, being turned over to a collection agency because they're not paying bills. So that's 1/3. And that had real implications for the subject of this talk, is that it related to suicide risk. It actually tripled the risk. And that's 1 year later. If a veteran didn't have enough money to pay for food, clothes, shelter, medical care, they had 3 times more likely a chance of being suicidal 1 year later. And that is consistent with other research showing that unsecured debt is associated with higher suicide attempts and completed suicide. So take-home message from this is you as transitioning service members, there are things that you need to know about in terms of making sure that you don't fall victim to scams, that you have financial education, that you begin to think about your financial well-being, because those do relate to mental health. Next slide. So this is, let me describe this, because none of that happens in a vacuum. And all of those listed, all those protective factors, each one of those, having a job, having money to cover your basic needs, being able to take care of yourself, having living stability, showing resilience, believing that you have control over your future, spiritual faith, and having a solid social support network. Each of those are protective factors that relate to reduced risk of suicide. And I would point out that on the bottom, when you see the 0 to 8, those are the number of protective factors that veterans had. And you can see those little N's that are next to that. The good news is that you could see right under the 8 is N equals 281. Most of the veterans in this random representative sample had most protective factors, and that's good news. But the column on the left is whether or not they were suicidal 1 year later. And so if you press the button, as veterans begin to have more protective factors, their risk of suicide went down. Ball won't be exactly where it's supposed to be, but that's okay. You get the idea. That went down 95% by having all A protective factors compared to having none. And so what the bouncing ball can be, would be thinking about adding each of those protective factors to your lives when you transition from the military to civilian life. The more of those protective factors you have, the lower, in fact, 95% lower rate of suicidal ideation one year later. And you know, if you have work and employment, that's going to be related to whether you have enough money to cover your basic needs, to your living stability. So what the idea is that they're cumulative. You want to be looking at having as many of those in your lives as possible. Next slide. And earlier on the research and working with veterans, I began to see this paradox, which is when you're on active duty, when you're a service member, you actually have a job, you have the support of your unit, you have a mission, you have money to cover basic needs, you have living stability. And in some ways, that's when you transition from the military to civilian life, the carpet is metaphorically swept out from under you. And those things are not necessarily present in the community. So developing those protective factors, getting a job being so critical, but making sure that the money that you get from that job is helping make sure you have living stability and reduce your risk of homelessness. Make sure that you're able to cover your basic needs is a really important part of successful transition to civilian life. As part of that, the Office of Mental Health and Suicide Prevention is funded. We are creating a Veteran Technical Assistance Center for Financial Empowerment. This was just funded a few months ago, and as one of the first parts of that, we developed a list of 74 financial resources that you could immediately access. They've put those on the next slides. If you want to go to the next slide. And I'm just gonna, because we started a little late, I'll just quickly go through them, and they'll also be available for download. These are, if you are or know someone who's experiencing financial emergencies, these are links that you can immediately go to learn about that. And all the way on the bottom too, there's one, and you may not even be aware, the Department of Defense has an Office of Financial Readiness, and they have COVID resources for the military community. Next slide. Please be very vigilant. There's been actual COVID-19 scams that target military populations. These are links to see what those are. Next slide. This may or may not be an issue, but if you know someone that if they really are beginning to run out of food, these are links that are available. Next slide. The bunch of really helpful resources in terms of preparing for financial emergencies to help you prepare, and again, please share this with others. Next slide. More on financial scams. Next slide. If these are applying for unemployment, how do you do that? Maybe less relevant. Thank you. Next slide. And there are a number of resources for service members, veterans, specifically the DoD Office of Financial Readiness, and Military One Source is excellent. There's a whole host, and please begin to access these veterans resources so that you could immediately start helping yourself save money on a day-to-day basis. There are, and I cannot endorse any apps, but if you are a military member or are a veteran, and there are many apps that are available that if you just search for veterans discounts or military discounts, some of them will tell you every discount that you can have within a 50 square mile radius of where you're standing, and every asking, do you have a veteran discount for any purchase above $50? We had one veteran who figured out that it was saving him about $50 a month. That's $600 a year. That's $6,000 in 10 years which he felt very good about because he always did that. And that's just one thing that you can do to save money and to make sure that your basic needs are met, and that the money that you do earn from your employment is really, you're able to save it and improve your financial and emotional well-being. Thanks, and I'm going to turn it over.
I'm Renetta Bradford, as you can see here. Oh, I'm sorry, am I muted? No. Oh, good, great. All right, and I am here with the Department of Veteran Affairs, as you see, and I am going to just segue into a way to help you in your financial security, especially in the area of employment. You've heard already and you also personally know that having employment is very helpful in every way possible, in taking care of your family and definitely as far as your mental stability is concerned. I know when I was unemployed, it didn't feel good at all. And so I'm hoping that in this very quick session, and I just want you all to know that I do provide a longer webinar that's about 2 hours that gives you a really in-depth overview of the USAJobs.gov as one of our platforms in the federal government to obtain employment. But really quick, for the purpose of this, this session, I want to just talk to you about how you can align your military skills and education with federal occupations. And so I call this the MOS AFSC, if you're in the Air Force like me, versus the Occupation Series Code of the federal government. So right away, for those of you who may not know, USAJobs.gov is the location where you would apply for most jobs for the federal government, including those jobs that you're seeking in the Department of Veterans Affairs. And so for the most part, when you go to USAJobs.gov and you do a search, what I want to show you is how to narrow that search, but more importantly, how to determine which occupation series, when you are looking for positions in the federal government, best aligns with your education and your skills. And I know you want to know that because that is normally the biggest challenge that we have when we go to USAJobs.gov. You see over 7,000 to 10,000 positions that are open across the country. And the only way you look for jobs for the most part is you look at the title and you try to make a decision on whether or not that title resonates with you. And if so, you may decide to apply. But I want to show you a better way, and that is through the occupation series. Next slide, please. And so in the federal government, we have what we call occupation series. It's coming through. There it is. We have federal occupations that are directly related to your college major, believe it or not. It will help align your education with these occupations when seeking opportunities. So if you just want to know what occupations aligns just with my college major, you can go to USAJobs.gov. You see this link here, and it provides you a list of positions that are, or series, I should say, occupation series that aligns with your college major. All right. Additionally, in this same list, it shows you an asterisk beside those occupations that does require an academic degree or coursework in a particular area. And this is free to you through USAJobs.gov. You see that link there? Just click on it. It's going to give you the information you're looking for. Next slide, please. So this is a sample. I just wanted you to see it for yourself, that when you go to that link, you will see an A through Z listing of occupations by college major. So right away in the A through AST, accounting is what you see there. Under that, to the right, that 0244 that you see there and the other numbers, that's the occupation series for that particular position. So if you have a major in accounting, it's showing you the list of A through, it says A through AST. So this is just accounting alone of the positions that you can apply for that's attached to your college major. And where you see the asterisk there, it says that you must have a degree in that particular area of study as well to be able to apply for those positions. Next slide, please. And then the next one is you get to choose by experience. So whether you have a college major or college degree or not, or you have a college degree along with experience, there is a handbook that is free to you called the Handbook of Occupational Groups and Families. And you see that link there that you will be able to click on. And in this occupational group and families, it provides you, yes, I'm about to tell you something that's fantastic, a listing of all the federal occupation groups and all of the series that fall under that group, of which you could be or have the experience, or you would look to see which areas you know you have experience in to determine the series that you need to apply for. And let me show you that with the next slide. And it's really small, and I apologize to you, but I just wanted to show you very briefly, if we can enlarge, I'm not sure if it can be even large, but I wanted to show you here that an example of an occupation group is 0300. That's an occupational group, right? And it says it's clerical, administrative, and clerical and office services group. This is in the area of management. Where if you look under the 0300 series, or I'm sorry, family, you will see several occupation series from 0301 all the way over to 0399. When you see that series, you will be able to scroll down if you find that these are areas of where you have experience based on your skills and or your education. You would then scroll further down into this handbook. As you can see, it's 204 pages long, and then it will give you an overview of the skills that are required for that series. And if you possess those skills in your employment history, you know that you can apply for positions in that particular series in the federal government. So I call this helping you to find a needle in a haystack. So once again, you can either look by your college major to determine which occupation series aligns with your education, or you can look by your experience to determine which occupations align with your skills and education. And so these are free to you. They're online resources that I hope has helped you a little bit get started in seeking federal occupations. Next slide, please.
Well, thank you for that. So I just want to remind everybody, if you do have any questions for any of our panelists, please put those in the Q&A function down below on your Zoom link, and then we'll ask those questions. And if you want to ask a particular person a question, please just indicate that in your Q&A. So I do see we have and I think this is much for HOH as it is for our panelists, but you know, are there any resources out there that allows people to take a deeper dive onto these issues? Somebody asked for, Sylvia Morris asked for a 2-hour lesson on this subject. Does any of our speakers have any thoughts on where there may be information, deeper dives available? And if not, you know, we can look at whether, you know, HOH can set up a deeper dive on this.
So in the area of employment and the federal hiring process, as far as occupation series, how to navigate the USAJos.gov, I'm working with Hiring Our Heroes. I am a part of their Transition Tuesday, where I provide webinars to those individuals, as well as their Amplify events that I do with the military spouses. And then, of course, in the Department of Veteran Affairs, I also host webinars myself outside of Hiring Our Heroes. As a matter of fact, I'll be hosting one today from 1 to 3 o'clock.
So great. Any other thoughts, Dr. Albogen or Dr. Miller? All right. Another question, and this is another one directed at HOH, is will the presentations be available offline to have better access to all the resources and the links discussed? You know, typically these sessions are recorded, so we do make those available. It takes a couple of days to get everything together, so we will certainly make this the video available, and then we'll work with with each of the presenters to make sure that all of their content can also be published. But the short answer is we will publish something and make resources and the slides available for all the users or all the attendees today and for a larger audience. All right, do we have any other questions for our speakers? Any of the content that was discussed today? We'll give it just a couple of more seconds. Some really helpful information, lots of great information. So really, I'm not terribly surprised we don't have a ton of questions, in part because the content was so thorough. And I suspect that for many of the speakers, many of the attendees and myself included, you're still absorbing a lot of this and thinking about, well, hey, where do I go and how does this impact me? Well, I don't see any other questions, and I want to be mindful of everyone's time. We are very close to the end of the hour. But I do, again, want to thank, first and foremost, our speakers today. What a great session. Thank you so much for all that you do for our service members. Thank you for everything that you do for our service members and their families and your commitment. Obviously, the work that you're doing on mental health and wellness is of critical importance, especially during the current COVID-19 pandemic and crisis that our country is facing. So thank you for that. Also, one additional thanks to the Wounded Warrior Project for powering today's and all Wellness Wednesday events. Really great organization, one that we're really proud of to partner with. But thanks again. I hope everyone keeps well, and look forward to seeing you at our events next week. So thank you all. Take care and see you soon.
Bye, everybody.
Bye.
Bye.